I'm a licensed marriage and family therapist and a registered nurse, and I've had a successful practice as a marriage and family therapist since 1985.
Okay.
And my specialty is in sex therapy.
Okay. You know what? Let's get right into that. This is a little more unique than a lot of the doctors that I interview on the whole premature ejaculation topic.
Right.
Because you work with married couples, and I'm sure a lot of my other, interviewees do as well.
Mm-hmm.
But my question always stands. Whenever there's a sexual issue within a relationship, it's got to be a balance of both genders, of the husband and the wife. Talk a little bit, if you could, about what both parties go through when there's a sexual issue, no matter what it is, if you could. Some of the things that you've seen that you've noticed and things that you've been able to help your patients overcome.
Okay. It's always hard to know when somebody calls and says that the man has premature ejaculation, whether or not it is actually that. Mm-hmm. Because sometimes it can be the woman is having difficulty with orgasm. Mm-hmm. Sometimes it can be where they're just having difficulty with one another and they're not getting along, or she's not interested in sex. And then there are times when it is where the man is having a problem. And it's important to know that there are different levels of premature ejaculation as well. There's a very mild premature ejaculation, there's moderate, there's a severe, and there's extremely severe.
Yeah.
So that mild, a man can begin to have intercourse and can last from 3 to 5 minutes. And he has a sense of what is the point of inevitability.
Yeah.
He can feel himself slipping into orgasm. And sometimes these men last long enough, and women are comfortable with that's not a huge issue because sometimes he does last long enough.
Yeah.
And then it can be moderate where a man can begin intercourse and last from 2 to 3 minutes before having an orgasm. And sometimes with that, men will come in by themselves saying, my partner's just not happy. Or they'll come in saying that they've lost their relationship because the woman was so very unhappy.
Yeah.
And sometimes they'll come in saying, I'm not happy, and my partner is okay, because some women can climax kind of quickly, mm-hmm. whereas some women are very, very frustrated. Also, sometimes men are able to help women by giving them an orgasm in a different way, mm-hmm. so that it's not necessarily with intercourse, because some women are unhappy if they can't have orgasm in intercourse, and some women are kind of okay with having an orgasm in another way because they've never had an orgasm in another way. And so it's a bit challenging to try to figure out how to help the person if we can't define it first. So first we have to figure out what's going on, because there's unfortunately, there's a lot of people who are not enjoying sex as much as they can.
Right. And I know that there's, of course, different levels of arousal. And is that one of the things that, I guess it could be, produced psychologically, some patterns of thought or things that couples can do together. Do you work with that a lot? Like, like maybe a man or a woman or either one,
yes.
Or just having an issue with arousal. What are some of the things that you would consider that could actually help, fix that issue?
Well, there's different levels of desire. Yeah. Sometimes a man wants sex a lot more than a woman does, and sometimes a woman wants sex a lot more than a man does. Mm-hmm. And that's a real challenge. And part of it has to do with having other ways of dealing with your excitement, of being able to climax or to masturbate a little more frequently, for instance. But also sometimes people learn to just kind of have more satisfaction in the moment that they are experiencing sex and lower their desire and kind of meet the other person. There has to be a way in which we find a way of compromising or working things out.
Yeah.
So there's different levels of desire, and that's always a challenge for couples. Just like we each want things differently. How do we figure that out in a relationship?
Right,
we have
right.
to have other things that we like about the person. There has to be other things that are more important, common interests, common goals.
Right.
Those are the things that bring people together, and those are the things that cement a relationship is those common
one of the
values.
Yeah, I was going to help you there for a second.
Thanks.
Even in my own relationship with my wife, I know a lot of guys want to know what they can do to make lovemaking better, make sex better, make the experience better. And I know that communication is extraordinarily not only powerful, but there are some levels. Have you ever noticed, well, I'm sure you have, but there's some levels where the other partner won't feel comfortable communicating or is so quiet. And how do you help your patients get past that? Like if one partner's not telling the other partner, okay, look, this is what's really bothering me, or this would be really cool, but maybe I'm embarrassed to talk about it.
Right. Well, one of the things that I work with that comes from some really good research on what makes couples successful and what successful couples experience. Mm-hmm. And one of the things they found is that there's different relationship styles, and that's one of the things that I look into. And what they're actually persuasion styles, and they are successful. The big deal is if you're the same persuasion style. And so what I call them is there's a calm style, there's a nesting style, and there's an intent style. And the intent style is the person that wants to connect emotionally.
Yeah.
And the nesting style wants to talk about the issue all the way out, to get all of the pieces out on the table. And the calm style persuades by talking about how good the relationship is. And they're the doing style. They're the conflict avoidance style. They don't like to upset people, and so they'll not talk about things, but they'll hear the issue and they'll try to change it by doing something.
Yeah.
Well, you can see where there'll be a problem if you've got somebody who's intense and wants to try to figure it out right now and is very impatient, and then you've got the patient, calm person who just wants to, okay, I hear you, don't get upset, let me just do something about it. And this really relates in the bedroom, right, where a guy may hear his wife saying, I want to really connect with you and I want to enjoy, and why can't we be passionate? What's wrong with you?
Right.
And the guy's hearing this and going, well, if you give me a chance.
Right. I know that, we can get through a whole bunch of, different facets of sexual issues. And I know that a lot of men, do have legitimate physical problems that in some cases need physical solutions, whether it be oral medication, injection, whatever the case may be. But in my experience, and of course I wouldn't stray from discussing my own experience because I'm the one interviewing you, and in my experience there is a psychological attribute to it. And no matter